really want to help people understand that they are different parts of the body and the pain presents differently. So let's talk about how the pain presents in a joint first.
That's right. So in a joint, most of these pains that we're going to experience are arthritic in nature. So that's going to be a stiff, achy joint. You might just be sitting in a chair for a long time. You go to get up. Ooh, it's stiff. It's achy. It's hard for me to get moving. That's generally arthritis. That's generally a joint problem.
And then a tendon. Let's talk about where, and tendons are between the bones, is that right? I'm trying to remember tendon location exactly.
So a muscle is going to attach to the tendon, and the tendon is going to grab onto the bone and move the bone as like a lever arm. So if we want to raise our arm, that tendon is going to have to work to raise the arm. A tendon problem generally doesn't get much better. If we overuse it, every time we raise the arm in this manner, we have a sharp pain right here in the shoulder, that's generally a tendon problem. Versus a muscle strain will usually get better over a few days, maybe a few weeks, maybe it's a little sore, but as you use it, it tends to get a little bit better. Tendon problems generally just get worse. Tearing can get worse, dysfunction can increase, and we go from just some pain to even some weakness as well.
So with muscle soreness or tenderness, you kind of have to, depending on the severity, but when it's on the lower end, you kind of have to just keep working the muscle and let it heal on its own typically. With a tendon tear or damage, that takes surgery to repair normally, right?
It can. If it's just a partial or a small tear, many of those we can treat non-operatively and your body's going to get well from that, but at least we know. At least we're making a good informed decision. If it's a complete tear, we just want to know about it soon, because if we let it fester or let it go on further, it can be really hard to deal with down the road. It's really difficult to deal with a tear if it was 5 years ago and somebody just pushed it to the wayside.
And you said you've had patients do that too.
Oh yeah, and it's such a hard problem to manage at that point. If they'd have came in early, it was a simple, easy fix, on down the road, back to the way they were. It's also, we're trying to juggle, I just got hurt yesterday, do I need to see somebody? Well, if it's extremely painful, if you're fairly dysfunctional, if you felt a very painful pop, we want to know about that soon.
Right, immediately. And then as far as like the joint pain that usually is associated with arthritis, that's a whole separate layer of treatment. And what are the remedies down the line from that? Minor medication all the way down to surgery, replacements if necessary?
That's right. So I talk about a spectrum of treatment, and if it's early on in the spectrum, you might just do something simple like do some exercise or maybe take a simple Tylenol, simple anti-inflammatories when you need it. Stepping things up, there are certain different types of injections that we can do to help people. There are even certain braces for arthritis that can really tremendously help people. And ultimately, if it's really bad and we've tried everything else and you want to look into something further, joint replacement surgery can be somebody's best bet.
But you got to talk to your doctor about what's happening and be specific about what the pain is and where it's located.
Exactly right.
All right, Dr. Roubion, thanks so much for your time this morning. We appreciate you.
Thank you.